It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the training culture of your regular program.
The movement towards universal health coverage is now one of the most prominent global health policies. According to United Nations Sustainable Development Goals, all UN member states have agreed to try to achieve universal health coverage by 2030. This includes financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality and affordable essential medicines and vaccines for all. Although several challenges in terms of health services and financial protection coverage play out as more countries make commitments to universal health coverage. Our expert today will be sharing with us on how we can all come together to strengthen the primary healthcare system in order to achieve universal health coverage on your regular health talk show, The Physician. Welcome. If you're just joining us, this is The Physicians, where your health is our business. I remain Dr. Memuna Yusuf Kadri, and of course, I'm never alone on this program. My co-host is the delectable
I'm Dr. Martina Agberian. Welcome to The Physicians, where your health is our business.
Today we're talking about strengthening our primary healthcare system.
Yes.
And of course, it's not just to strengthen it, but we want to use primary healthcare system as a pathway to achieve universal health coverage. I will speak for myself right now. Even if I have my insurance, there are still some services I do out of the pocket payment. I'm tired. And I strongly believe our primary healthcare system, if it's strengthened, there's so much more we can achieve.
Well, all I have to say is the community involvement is very, very, very important, because if the community is not strengthened, there is no primary health care.
How do you get to strengthen the community? Community has to be aware that this is what
they
is
have
happening.
to be involved.
Yeah.
If they're involved, if you take it, and if there's advocacy, you let them know about primary health care, that if the community works, if they come together as a community and take health seriously
As wealth,
it will work. We also need to have some things, that the basic things available.
That, yeah, right.
For instance,
Good roads,
good
electricity,
A woman who is in labor,
water.
how do you expect that woman to get
move
to the primary health care
Have you
center?
gotten the news that made rounds not too long ago of a community that they came together? I think everybody donated 1,000 naira and they bought a car. So if you are not feeling fine, especially the pregnant women, they take the woman to
that goes back to what I'm saying again.
Yeah, the community involvement. Yeah, very, very, very key. And I'm guess our guest coming to the studio today is an expert in it and is very passionate about
primary healthcare.
Yeah. And of course, telling us the standards, the benefits of having primary healthcare, and how we can actually use this to achieve universal health coverage. Don't worry, we'll be right back after this time out. If you're just joining us, this is your regular health talk show, The Physicians, where your health is our business. On today's show, we will be talking about strengthening the primary healthcare system, the pathway to achieve universal health coverage. And we have an amazing guest in the studio who is going to talk to us about the importance of primary health care and how we are going to achieve universal health coverage with this awesome approach to our healthcare system. We have Dr. Oladapo Bao Ashiyombi. I think I got that right. He's a member of the Association of the Primary Healthcare Physicians of Nigeria. You're welcome, Dr. Ashiyombi.
Thank you very much. My pleasure to be here.
So, Dr. Ashiyombi, what
Yes.
are the current primary healthcare standards? Because before you can achieve universal health coverage,
must
it's
have
always
standards,
good
yeah.
we know what primary
The basic.
healthcare is.
Okay. Primary care is a departure from what used to happen before 1978. And the standards for primary care are really in its own definition. And that is, it says primary care is universal health care that is essential and is made available to families, individuals, and community with a recognized acceptable scientific standard.
Recognized
Acceptable scientific standards.
So that standard must be recognized, must be acceptable to the community.
Acceptable.
Yes, to the community.
So the community has
Yes,
a
yes.
They must be involved.
At every stage that they can afford along their development. It has to be one, universal, essential.
Yeah.
Now, all these are components of what universal health coverage looks at. Universal health coverage looks at three things. One, quality of care. Equity based on need. The second aspect of universal health coverage looks at financial protection. So that if you want to spend money on your health care, whether by yourself or by a communal contribution, it should not make you poor.
Yeah.
So, let's say somebody needs cesarean section now. The market value will be going from between 50 and, let's say, 2 million.
Depending on where you get the care.
And the kind of care you say you want.
Oh,
So if you go to a 5-star,
Yeah.
no, if you want a 5-star cesarean section,
Yeah, right.
the hospital that if you come in from the gate, they give you coke. And after that, they park your car for you on a valet, and then you have a one-room chauffeur. Then while they are doing the operation, they even give you DVD to see it.
Yeah.
However, not everybody needs that.
Yeah.
What you are even saying now, just it's taking me back memory lane during the peak of the pandemic,
yes.
where people had to deposit 10 million in some private hospitals for them to be taken care of
For COVID.
for COVID.
Well, you see, that's why I said these things is a spectrum. You have said it is private.
Yeah.
So whoever sets up his healthcare service didn't set it up for loss and not as a social service only.
Yeah. Yeah.
He set it up for
Profit.
return
Okay,
of
okay.
investment. Let's be clear on that. Now, when it now comes to the public sector, you will get maybe average the same type of care, maybe not with the AC and all the other things. However, really, what they give you, if they give you oxygen in the private sector, you will not consume more than that in the public sector.
Sure.
However, what happens is that government carries a lot of the burden on your behalf in the public sector.
Yeah.
It is a scientifically sound sector, system. However, what it has is that it thinks of the social things that help you determine your health status. This is what I mean. So you are in a community. So let me make two comparisons.
What about determinants of
Yeah,
health?
exactly. Let me make two comparisons. So somebody lives in a farming community, maybe somewhere in Irua, in Edo State. And then somebody lives in Lekki Phase 1 in Lagos State,
Which is urban.
which is urban, which is I mean, very, very cosmopolitan. And the kind of people can afford to live there. And not those who earn 30,000 naira per month. Okay, so this agricultural community makes gari. And in that community, I will tell you why I mentioned the rule, you understand that. They make gari and then they spread it on the floor.
Yeah.
They dry it. However, while you are doing that, you invite rats to come there. They want to eat. As they eat, they pee and wee on it. And the next thing, Lassa comes. So that's why Lassa is common in that environment. More in agriculture setting. You are not likely going to get that in Lekki Phase 1 because they don't put gari
on the floor.
So the gari will leave Irua. Then somebody in Lekki Phase 1 will go to Obalende, send maybe the house help and buy. And then when it gets there, they cover it. So rats will not get there. Now, if you are not building the primary healthcare system, which is the first level of contact for those two areas, it has to be different.
Sure.
You have to recognize the common conditions, disease in Irua versus the common conditions in Lekki Phase 1. So if you are doing something in Irua, you must plan for Lassa.
Exactly. It's
as part of it's a common. Now that brings us to some of the standard of primary care. Primary care has 11 components. It used to be 8. One of them is control of common epidemic and endemic disease. So you see, it is not a one size fits all. What will work for the people of Irua will not be what you carry, cut and paste and put in Lekki Phase 1.
What I want to ask is this: before talking about strengthening the primary healthcare system, we know there are challenges.
Yes.
What are those challenges?
All right. So several surveys have been done, but for Nigeria, some bodies have done surveys, and what they see come from part of the, how will I call it, the 4 pillars of the primary healthcare system, which are 1, community participation. It is the most important pillar of primary healthcare system. So the community need to participate more to know their health status, plan for their health status, own their health status, manage their health status. And that talks to leadership and governance. The leadership of governance should come from community level to national level.
Not the other way around.
Exactly.
Because we are very good in this country blaming government. Let it start from the community.
So before the government makes a policy about primary health care, they should aggregate opinion of those who are leaders in the communities and then add it before it gets up. There. The second thing is intersectoral collaboration.
Okay.
Primary care, like I said, it deals with some of the social determinants of health. Like if you are too poor, there's no way you can afford to the better. Now, poverty, infections, and disease go together. So, if somebody is poor, what do? The health system cannot give you money. Yeah. But what they can help you do is link you with people who do poverty alleviation. So, you have to go to another agency to help you to earn money, live a good life, and then you are likely going to have better health. Yeah. Even if you build a very beautiful primary care system, even in Irua, if the road that leads there is bad, people cannot get there.
All right.
So it's a beautiful health facility that is useless, where people cannot get there.
You have a lot of that.
Or it is too far
from people.
You know, I mentioned that one of the things is equity based on need. So if the people in Irua need more health facilities than those in Lekki Phase 1, then provide for those ones first. But even if it's the Lekki Phase 1, they actually need more than the people in Irua. Need.
Not want.
Yes, need.
Dr. Ashura, just hold it right there.
Thank you.
We are not, in any way trying to make comparison with people in Irua and Lekki Phase 1. This is just for us to understand how important our primary health care is, and in achieving our universal health coverage, how we can strengthen this primary health care. We're going to the street right now. We're keeping up with the physicians, and let us hear from you, our awesome, participants all over the world, just to know what you think about primary health care and the importance of it to our universal health care coverage. We'll be right back after this time out.
It has been long. I made an attempt to visit an hospital.
Last week.
Last week.
The last time I visited the hospital was last year, 10th August.
We have one medical health center at Agura of Igberibe. They call it Agura Community Health Center.
The one I know for Itiosa Health Center.
They call it a primary health care center. Yes, in Ekpe, local government.
The primary health facility in my locality is Emmanuel General Hospital, Eket, in Akwa Ibom State.
I've never been there anyway, but my wife has been there. My wife has taken my children for treatment.
They are not taking people seriously.
You wait for doctor for 2-3 hours. The nurses, they will just be, even though you are feeling pain, they don't care. But if you have your money, then everything go fast for you.
It's not all about to set a very good edifice or El Dorado as a primary health center, whereas the character of those workers are not okay.
And this can be strengthened if federal government, time to time, review the policy of primary health care center.
The only way we can strengthen the operation is to start good functioning.
Yes, our hospitals, our doctors, they're supposed to take care of them by government.
The government should try to improve on this service delivery by ensuring that they pay these workers on time. They listen to them.
If you're just joining us, this is The Physicians, where your health is our business. And of course, today we're talking about strengthening the primary health care system, the pathway to achieving universal health coverage. And we have our amazing guest who is doing justice to this topic, Dr. Ashiyombi. We're talking about the challenges of the primary health care. We talked about, the part
Community
community participation, intersectoral collaboration.
Yes.
What are the other two?
Okay, let me just quickly finish that intersectoral is very important too. You also need partnership.
Very important.
So both local and international, so that everybody will put their hands together and support that system. It's still the first level of care that people will receive. Now, people confuse primary health care clinic to primary health care system.
Oh.
Clinic is a building.
It's a building, yeah.
Where people go to get care. But primary care, like I said, starts from individual and families and community. So it's actually, more of it is outside the clinic, where you do more of community education, preventive care, so that the amount people will need to be treated if they are sick will be less.
Yeah.
Out of 100 naira that Nigeria spends on health, 75% comes from people's pocket.
Out of pocket payment.
Not from budget. And that's why a lot of people cannot afford it. They would rather go to the chemist or use traditional means. So how do we save people from spending that much on health? So the same 70% that you are spending individually, you are now encouraged to pool the money together. If you pool it together into something like a health insurance, then you are likely going to buy more. So if 100 people are in a place and each of them spend 70 naira to buy paracetamol, imagine if that 70 naira is pulled together times 100. That becomes 7,000.
Yeah.
You are going to buy more paracetamol than if you are buying 70 naira.
Exactly.
That's the idea of pooling resources.
So do you think this is actually working in communities?
No, we have to
resources
have to
together?
let people understand.
Are they aware? Do you think the sensitization is
Well,
enough? The awareness is
that's
enough?
why you see, one of the components of health, of primary health care, is health education.
Whose responsibility is it?
Everybody.
In the community?
Everybody. I said everything will start from the community. It's not the government. The community must
the
own
community
their health.
participation is
It's very key. Another component of PHC is equity. That means you provide according to need. So if a short person wants to watch football over a wall, and a tall person also wants to watch the same football, it's not going to make sense for you to give the ladder to the tall person.
Ladder for the short person.
Good. So support the person who needs it most with more resources. provide more healthcare to those who are more vulnerable. Another aspect of universal healthcare is quality. Nigerians believe that if you go to a primary healthcare system,
you are poor.
One, and you get very secondary. I mean, the people there don't know anything.
But let's face the reality. Do we really have these things available at the primary healthcare level?
Yes, they are. The question is, what do you need? Do you need a professor to treat you for malaria at the PhD? So if I ask you, who do you want to treat?
About having a professor there now. Do we have the resource? Do we have the things available?
No, it's clear we don't have. Like I said, no.
Want to patronize the
get the resource. The resource is one thing. The human resource is part of it. Okay. So the thing you want to ask is, what do you need in this primary health care for this community?
Yes.
The doctor that is working the PhD went to the same medical school to the person working in the teaching hospital. They are colleagues. They just happen to find themselves in different systems. That's just it. No, the people know what their problems are.
Dr. Ashwin,
you just need to communicate with them and they will support you.
I think I need you to, expatiate on for Nigerians. COVID happened. Nobody saw that coming. And that exposed how fragile our healthcare system is, both in infrastructure and human resources. The healthcare providers and all people with billions couldn't even save their lives. Let that take us back to Abuja Declaration.
Yes.
2001. That stipulated that at least we should have 15% budget of healthcare, of our money to the healthcare. Why
is it difficult for us?
Why is this so difficult?
The first thing you have to understand is the health system is part of the whole national system.
Exactly.
So, Abuja Declaration saying 15 for health. 15 times 7 is how much? That's 105.
105.
So what you are saying is that Nigeria should actually have just 7 ministries. Health will be 1/7. So give it to 15%. So what will defense have? First, WHO now says that to achieve universal health coverage, the strategy is to use the primary healthcare system.
Exactly.
In that same document, it now says that for countries to meet this goal in like 10 years' time, they need to allocate 15% of their GDP. No, not budget.
Yeah.
There's a difference between budget and GDP. Now,
yes.
What is the story of GDP and budget in Nigeria? Nigeria's GDP is in the region of $450 billion, right? At the end of the year, Nigeria only collects 5% of that as tax, which is like 2.5 billion. So the whole country itself is not even collecting the 15%
of the GDP.
So how can they now give you 15% of the GDP? So what is that telling is that, one, Nigerians need to contribute more to see the kind of things they want to see.
So we should be all part of the system.
Yes. Now, if the whole country gets 5% of GDP, then Abuja says you should give it 15% of the budget. So you're actually giving health 15% of 5%.
Yeah.
So you see that you have a long way.
I think I agree with what you have said. Nigerians, we cooperate a lot. The moment you are able to let people know that this is what we need to do, and then achieving this, they will do it.
Yes.
But not when they see that up there, nothing is being done.
You know why? We are every time looking up there.
So we should be looking down.
I told you 2 things are what they say are the problem: leadership and governance, and then health finance.
Yeah.
I did not say general health finance. So first thing is, what kind of leadership do you have from the community level to the national level for primary health care? Are you putting people in positions because they have a vision and that can help you? Or you are put them in position because they help you to win election, or they are your friends and family? So there's not just leadership only at the general level now, even leadership at the health sector level.
Very key.
Because even if they give you 1% of 15%, have you used it
judiciously?
Yes. So that people who give you, we say, haven't done this.
Let's give you
There's
more.
no choice. We have to give. The community around you will support you.
And they truly do that when they see results.
I've seen primary healthcare clinics that because of the kind of leadership at that level, the community start donating fan, bedspread,
Sure.
mattress,
Yes.
and it's them they would use
Capitals
it.
will do the
So
shares.
that
Yes.
one is not budgetary allocation. No.
Allocation.
Is that
Community.
this is where we need this,
So we have
and
to
we are
up-
going to be the one to use it.
I think we just need proper leadership
Yes.
at
Yeah.
the community level.
Leadership and
you let
governance.
them
All
know
the way.
and talk
Yeah.
to
All
them.
the
They
way.
will and if the people understand, they will actually
and they
key
see
in.
result, they will.
They key in.
Thank you so much, Dr.
You're
Sharon,
welcome.
because this topic can never
Be exhausted.
because we all need to keep hearing the importance and strengthening of our primary healthcare system in order for us to achieve universal health coverage. Thank you very much once again for being part of this show.
welcome.
Viewers out there, you've all heard about this. This is not the first time we've talked about primary health care, and we keep talking about this every other time, just for you to understand the importance of primary health care for us to be able to achieve universal health coverage. Community participation, as you've heard from our guests, is very key. My name remains Dr. Memuna Yusuf Kadri, and of course,
I'm Dr. Martina Agbere. Well, again, thank you again, Dr.
My pleasure.
For coming on our Dr. Ashio DB for coming on our program, and I apologize again for keeping you for so long. Well, follow us on our social media handle on our YouTube, Instagram, Facebook. You're always just a click away. If you want to be part of this program, just send an email, and we'll be there to welcome you. Thank you for staying tuned.
till next time, of course, stay blessed.
Yes, I'm Dr. Fasasi.
And I am Mrs. Owade Olasimbo.
It was very nice to be on the physicians. I am a dental enthusiast.
I am a dental therapist and also an oral health educator. So I'm very passionate about teaching people, educating people more about how to care for their teeth.
Keep watching the physicians.
The hand brush, it gives your teeth micro laceration, micro cracks. It will be lacerating your teeth gradually. You will not know until you start having tooth sensitivity.